All right, what's going on, guys? Dr. Alex Zayed, and we are back with the Icons Podcast. Today, I have a longtime friend and someone that's becoming a colleague in the anti-aging space. This is Dom Kuza. Dom, I'll kind of let you.
Thank you for having me today. We've known each other for a long time. We went to school at OU together for a little bit. You were a little past me though, a couple years ahead.
It's called older.
We had some classes together though.
Biochem.
Yeah, and then but yeah, I have my master's exercise science. All of my specialty was in advanced human physio, and then now I work in like medical consulting. I do anti-aging, longevity education, hormones, peptides, kind of you name it, I'll teach it.
Yeah, no, I know that. For people that don't know, you were pre-dental for a long time.
Yeah,
kind of like a shoe-in to, from my perspective at least, because we'd always be studying. Like when I was studying for my MCAT, probably could have had your pick for any dental or med school. So what took you from doing the traditional dental medical route into what you're doing now?
I got into dental school. I didn't go.
Yeah, figured.
I pulled out of Midwestern in Illinois, and then just wasn't for me. I worked as a dental assistant for a little bit. That was like, I couldn't do that every day.
Fun fact, I was actually pre-dental, and I had went and worked with this lady, and I showed up at 7 a.m., and by 9 a.m., I was like, thank you so much for the opportunity. I was like, this is not what I can do with my life.
I don't know. I just wasn't for me. And then I was into fitness, still am. That was like a bulk of my business for a long time. And then I just wanted to chase that. I knew there was school in it. I knew there was like exercise science degrees, stuff like that. OU had a master's program. So I did a post-batch for a little bit, and then I just rolled right in. I stayed at OU. I was there for 7 years. And then did my thesis there, and then that was it.
Yeah, so how did that roll into hormones, peptides?
Yeah.
Where did that come into the picture for you?
I got into like the professional like bodybuilding scene, and I mean, we're not naive to the fact that what bodybuilders do on a regular basis.
The
so I
scientist.
I had to learn a lot of like pharmacology, pharmacokinetics, like to work with these clients. And that kind of exposed me to like hormones. And then a lot of it just came naturally because my master's was in physio. It was just so simple to understand for me. Right. And then learning how to apply this to everyday people. Then I'm getting clients that are 45-year-old guys, 35-year-old women, low tests, I don't feel good, right? And then starting to build these connections. I did a few seminars, like went and like listened and did some like furtherment of my education on the side, because there's nothing in school that teaches this stuff. Not yet, at least.
Yeah. I always tell people the type of medicine that I practice right now in 20 years will be a residency.
Yeah.
This will be either its own residency, or it'll be like a sub-fellowship of endocrinology, or like a fellowship that you'll do after general practice, internal medicine, something of the sort, because there's such a thirst and need for it in the general population that there has to be like formal training.
Which is, it's crazy to think about. Like I work with other clinics and stuff, and I educate their NPs, their doctors, their mid-levels, and they're learning stuff that they've never even heard of before. But I think it will be like a sub-fellowship, or I think it could be like a spin-off of like endocrine. Like if you go into like endocrinology, like residency or something, and then twist into like a fellowship that has to do with like longevity and anti-aging. Yeah. I could start seeing that being a little bit more popular.
Yeah. One thing that you probably come across a lot, and I know it's like a day-to-day in my life, is majority, not all, but majority of medically trained professionals have a stigma against this field. And I know it because of my referrals. I'll have patients that are I have a select few like family and internal medicine doctors in the area, and some OBGYNs that will refer to me, but it took time. I have one OBGYN that got to know me through his wife. His wife did one of my weight loss programs, and then we introduced some hormone therapy, and he was like, what the heck? And, it changed his wife's entire life, like the way she felt, the way she looked, the way she was acting and feeling. And then he came in, we kind of talked it through. I was like, these are my protocols. This is why I do this. This is how I protect patients doing that. And he's like, yeah, that all makes sense. And I was like, I know. And he's like, but for 30 years, I said this. I was like, listen, man, I was only in med school like 4 years ago, and like testosterone was a bad word, and now it's like a mainstay. It's majority of what I do in my practice. So how do you overcome that? Like when you're talking to these providers, how are you kind of changing their mindset into accepting and feeling like maybe hormones and peptides are something that is a safe, viable option for their practice and patients?
I think a big part of it is you have to like look at the provider you're talking to. Some providers want like hardcore evidence. Like, I need to see studies. I need to see evidence that this works, that it's safe. And then some are a little bit more.
There, though.
Yeah, the studies
People
are there
need
now.
to understand that. The studies are there.
But then some providers are a little bit more open, a little bit more open-minded to, because also some of the things that they've been taught for a long time are now turning back. I mean, look at how we look at cholesterol now.
Correct.
It's completely changed.
Right.
Like, you don't even really look at a lipid panel anymore, you know, but they were taught that for so long. So some of them have understood that like the evolution of medicine is continuing, and they're a little bit more open to like hearing out and, you know, maybe trying like testosterone replacement therapy first in their clinic before bringing like peptides in and things like that. But then some just want like concrete evidence, like quality of life evidence, you know, evidence in blood work, evidence in literature that's there, which is a little bit difficult sometimes to get people to buy in on. But a lot of it is just doing the bare minimum that they're comfortable with and then bringing it into their practice and then seeing how their first couple patients do on it.
Yeah.
And that's usually where they're like, holy shit, this works.
Yeah. I was just going to ask you, I mean, I can assume the answer, but like, you know, how many times out of 10 is that doctor getting their foot in the door with something easy like testosterone and then just having this insatiable thirst for more? Like,
they want more.
What more can we introduce in the and it's not money. This is not a field that you make a ton of money in. Like, I've realized that as a business owner, but the results that you get from the patient, this is like as close to immediate gratification as you get in medicine, right? With so many things that we do, like managing cholesterol, diabetes, blood pressure, this is like, you actually get no gratification. It's just the person doesn't stroke out when they're 60.
Yeah.
But with hormones and peptides, you know, at your like 3-month follow-up appointment, you'll hear some pretty amazing things and it makes you feel great. So I bet those doctors just jump in on that.
I mean, dude, you'll feel better in 2 weeks.
Yeah.
Like, yeah, I mean, we get a lot of people that come into clinics and like they'll say they're depressed, they're anxious, right? They have no motivation. A lot of the times, like general practice is SSRI, like
All
right
day.
off the bat. A lot of guys are on SSRIs, you know, almost like in the wrong sense. They just never got their testosterone checked.
Well, so for me, traditional medical backing, right? When you talk about depression, this is how it's described. Like, this is the board question, right? It's a 44-year-old male, not really going to the gym anymore because he doesn't feel like it, not sleeping that good. He's gained 30 pounds, and he's either uninterested or no longer has the ability to have sex. Okay, if you go through a PHQ-9, which is like a depression questionnaire, that guy flags as moderate to severe depression. First line is to give him some Lexapro. What's Lexapro going to do? It's going to make him gain 15 pounds and exacerbate his erectile dysfunction. That guy's going to become a lot more depressed. Nowhere in the traditional medical algorithm does it say check a testosterone panel, because traditionally we always think testosterone is something that's going to make your moods go up and down. And that's what I kind of want. Something you touched on at the beginning is you got into this because of the fitness or bodybuilding space. So if you go out in the street and you interview a bunch of people, like who's taking testosterone, they're going to be like NFL players, WWE wrestlers, and bodybuilders. People don't understand the benefits that can come from hormones and peptides if you are just a lay person. Like, where is the world of hormone and peptides for the normal person that's going to the gym a couple times a week, is not really looking to have their shirt off on stage?
Yeah.
They're not a professional athlete.
I mean, that's the difference, right? Like, there's super physiological dosing and then there's just replacement dosing.
Correct.
You know, so you get a guy who's 45, 50 years old, testosterone's 150, they don't feel right, you know? And our goal is not to get them into, you know, bodybuilder range, WWE wrestler range. It's to get them to just a normal, balanced range. And I mean, dude, you're going to feel the quality of life changes like 100%. Crazy. Blood work will get better. Sleep will get better. Lean tissue will get better. One thing a lot of people don't talk about, which I think is super important, is how important testosterone is for bone density.
Oh.
Like, the reason why people die early is because of fractures. Your chances of dying go up if you have a severe fracture when you're older.
Oh, I have this conversation every day with women on my weight loss programs. I'm like, you look great. We need to gain 10 pounds. They're like, what? I'm like, listen, we need to make a deal. We need to up our protein. We need to get into the gym, or you literally just need to gain 10 pounds.
Yeah.
Like, because we need some cushion, because that fall is coming. It's coming one day for you, for me, for everybody in this room. And you just hope when that day comes, you have the infrastructure over your skeleton, that you're not breaking a femur or humerus. And then you're hoping that you're healthy enough that you bounce back quickly, because that increases your risk of mortality, morbidity over the age of 65. It skyrockets.
Yep.
And if you're a 65, 7-year-old and you end up in the hospital 3-4 weeks because of a long bone fracture and you don't get an embolism and die, it's going to take you like a year
to bounce back
from how deconditioned you've been. But people don't understand how much of what we do really is for a health benefit.
A big thing that like I focus on when I'm educating like clients or practitioners is it's the difference between health span and lifespan, right?
Oh, yeah.
You can live long, but if your years are disease ridden, it's not quality years.
Yeah, I say that all the time. Living is having a pulse.
Yeah.
Like, being alive is having a pulse. Living is having experiences. Like, I want to see I want to go on vacation with my grandkids.
That's why like medicine 3.0 coined with like ATIA, like the biggest push is you want disease-free years, not disease. You don't want to just live long and have chronic issues.
Span.
That's health span.
And that needs to be a word, I think, that's focused, that patients need to focus more on. It's so exciting when a patient brings this stuff up to me. They're like, hey, tell me, what's the deal with peptides? I'm like, let's talk. I'm like, Bella, clear my day. Like, let's jump into it, because I don't like to sell patients. And whenever I'm introducing this to patients, the way that I do it is we have like a little brochure. It says like weight management, libido management, mood, whatnot. I'm like, hey, go home, read about these things, go on TikTok, like get all of your information on these things, and then come back to me with questions. And those are the patients that are just going to do phenomenal. The ones that are like yearning for ways that they can improve their own longevity, they just end up doing phenomenal because we're not selling them on it. So they're going to adhere to the programs, and they're looking for that health span, right? They're looking for the longest viable life that they can actually be living while they're alive. And yeah, that's always exciting for me.
Yeah. Another thing, maybe, I don't know if you see it in the practice much yet, but we get a lot of people that inquire about like cognitive decline and improving neurodegenerative issues
all day,
and helping prevent that.
Yeah.
Because like a lot of this stuff that we're talking about today, I mean, really what you should, if you wanted to take away like a golden nugget from today's episode, is be proactive about this stuff. Don't be reactive to this stuff. Don't wait for it to happen. Be ahead of it. Right.
If you guys saw the comments I get on my Instagram, so I'll always get DMs because I'm constantly doing like aesthetic procedures to myself. I'll do lasers. The other day I posted, you probably saw it, I posted like my whole stack of hormones and peptides. Probably had 50 DMs. All people a little bit older than me that are like, why are you doing this? You're so young. When I was young. And I was like, that's the point. You're talking about how you felt when you were young. I don't want to feel like that. Yeah. I don't want to be 50 and looking at a 34-year-old and being like, man, I wish I felt like that again. I never want to decline. Why would I allow myself to go on the downslope? I know what's coming. I'm a doctor. I see people of all ages every single day. I see their ailments. I see the hip pain. I see the cognitive decline with early onset or just memory impairment in general. I see the weight gain. I see libido. I see the mood fluctuations. It's like if you're driving and you know there's like a car accident ahead, what do? You slow down. You get ready to swerve. Every single human being in the world knows that aging is happening. It's there. It's either coming in 10 years, it's coming in 20 years, it's coming in 30 years, but the ailments are coming. So why don't you start preventing today? So I always get that. People are like, why are you doing it? It's because prevention is the best medicine. Yeah. And hormones and peptides is a way of prevention. Who says it? It's either Atia or David Sinclair. We need to start thinking of aging as a disease and not something that's inevitable. Because we think of diabetes and Alzheimer's and depression and heart disease as diseases. So we treat those. And oftentimes we prevent those. A lot of people that are at the gym say they're there because my cardiologist or my primary care said I need my 150 minutes a week. So they're trying to prevent a heart attack. Well, you come to see guys like you and I to prevent aging and all the things that come with it.
Yeah, 100%. I couldn't agree more. Like another thing that we always talk about too is like we'll get people that say like, why am I hearing about this now? Right. And a lot of that comes because sex hormones are looked at as non-essential hormones.
Correct.
Like you could live without them technically. Like you wouldn't die if you had no sex hormones, but you're not going to live the most high quality of life if you were living like that.
It's so obvious to me, and patients are so happy, and patients that get on the program love it. I've never had anybody stop my testosterone program, and I'll go, hang out with my buddies from residency, and they're like, "What are you doing?" And I'm like, "You guys will see. Eventually, you guys will see the light." But
yeah, you're well ahead of the curve right now.
Sometimes, I mean, I meet other, the doctor that had this office was doing HRT 30 years ago, right? And I think about guys like that, and I'm like, man, what did you have to go through? Because I'll just get killed by other doctors on social media, doctors in the community, people that
imagine what he had to deal with.
I don't even know. I don't even know how he maintained a license at that point. So that's the other flip side of this that I think is important for people to understand is a third of my practice are people that are coming from really poorly managed hormone clinics. I had a guy the other day came to me. His erectile dysfunction got insanely worse on testosterone. He's like, I don't understand. Everyone told me you're supposed to get better. And I was like, cool. I was like, bring in your labs. He's like, what do you mean? I was like, oh no. He's like, I did a lab at the beginning and I haven't done one for a year. We check his estrogen.
It's probably through the roof. Yeah.
It's like 1 million. I really think women benefit from HRT even more than men.
Like women HRT is something that is very like taboo.
Oh yeah.
But
women and testosterone
changing. Women and testosterone
but
is
those words in the same sentence.
Yeah.
Like,
there's a doctor out in like Santa Monica area that I've gotten to know a little bit, and she's a really good like OB. She has a ton of patients on TRT, older women, postmenopausal, perimenopausal, and we were on the phone a couple weeks ago, and she was telling me like, yeah, like I'll tell them you need testosterone. They're like, what are you talking about?
That's what happens to us.
And I'm like, just trust me. And dude, they do a little bit of testosterone, few milligrams a week, and it's like instant.
I will say this about the benefits of testosterone and progesterone. Just read about those two things and what it does for your mood, for your body, for your sleep, for your anxiety. I mean, that is like something that we're getting texts at like 4 weeks. Women are like, what the heck? Like I knock out. They just take that little progesterone capsule.
Yeah, they sleep better.
Yeah, they knock out at night. Everything's better. Their mood, their relationship with their husband is 1 million times better. And it's not just sexual. Like it's not everything is
even if it's just like just the way they feel like mentally. I mean, like for like women listening, like you have a heavy period, you have bad, headaches, migraines around your menstrual cycle, bad PMS. A lot of that's due to the fact that you just have too much estrogen related to your progesterone, or you don't have like a strong progesterone production. Progesterone HRT is something we do that fixes a lot of that.
Big time. Sometimes that's the only thing. That's
sometimes it's not even an estrogen problem. It's just a progesterone problem.
Correct.
And then I can't speak highly enough about TRT for girls, though. I think it's something that a lot of girls will get labs back. They have a testosterone of like 6, 8, and you should be like in the 20 to 40 range.
Correct.
So like it's crazy to see some of these girls, the way they feel. They've been on, Zoloft for so long. Give them a little bit of test, they start to come off of the Zoloft and they feel better. I mean, I've helped some people through their doctors just get off of like their SSRIs.
Yeah.
Just by giving them TRT.
Yeah, that's a big conversation that I have. I always tell them, let your primary know that this is something that we're trying because you've been on this for 10 years. Like, you don't know what you don't know. Like, number one, you just might not even need to be on SSRI at all anymore. You really don't know. You've been on it so long. Like
you don't know what life is like without it.
Are you still depressed? And then, if they are, we're simultaneously optimizing them. And optimization doesn't always come with hormones and peptides. We talk a lot about vitamins. Like there's a whole slew of things that you should be doing in your life. Which is another thing I want to talk about is you as a coach.
Take this person, for example, and they're starting to hit this big wall. I mean, I do preach a lot that like your mindset and more, not even just your mindset, your attitude towards the situation plays a big role in your ability to succeed afterwards. And that's a huge thing that we'll talk about. Sometimes, we'll say, hey, let's maybe take a break from like pushing so hard in the gym or pushing your diet so hard. Maybe you just need a break.
Yeah.
And we'll pull you back for a little bit. And that prevents some burnout. That prevents them like packing up and leaving and never coming back. I just had to do that with a guy recently. A lot of really good progress. He's telling me I don't want to do this anymore, whatever. I said, listen, let's just chill for a week. Don't go to the gym. Just relax. Let's see if you can unwind. Came back Monday, dude. I feel awesome. I'm ready to go again.
Happens all.
And we've been having a really good. We've been having a really good week this past week, and he's rolling again. Sometimes you need to pull back a little bit. People want this like continuous linear weight loss, and it's just not feasible.
It's not going to happen.
Yeah.
I tell people something that's big for me, and you might disagree. A lot of people do. I love daily weigh-ins.
I think if you're not weighing yourself daily and using averages.
Well, and that's what I talk to people about. And they're like, I don't like to do that. It messes with my head. And I go, on a day-to-day, it will. I go, but check this out. Just bear with me. Do it daily. And I usually have them download like one of the apps.
Yeah,
where
just
Scale
to like
tracks
put it.
And I always tell them it's going to be a sawtooth, but it's going down. But we need some time. So over 3 months, what you're going to see is like your weight's going to just go up 3 to 5 pounds every single day, but it's trending in a down direction. When you look over those 3 months, you're going to see the starting and end point is just a downward slope. So on the day to day, you're going to have ups and downs. But the whole point of that is as long as you stay consistent, you're going to win.
Yeah.
Consistency wins in every field and every aspect of life every single time. But it's a mind game. I mean, I've been there. It's really hard. You go to the gym for a month, 6 weeks straight, you see absolutely no movement. Things are still happening.
Yeah.
Right. And sometimes it's just like you hit that plateau, you break through that wall, and it all falls. And but that's a really hard thing to coach people through. I mean, I'm not a coach. I wouldn't want to be. It's hard for me.
Yeah, no, I mean, I get people that give me pushback about like the daily weigh-ins and stuff, but you know, because I mean, a bad night of sleep, you'll be up 3 pounds the next day, right? Like if you don't drink enough water the day before, you might be up weight. You know, your weight might be up the next day, but we're looking at a moving average over time. And then like if they're really, really in their head about weighing every day, I'll tell them, give me 2 weekdays, give me 1 weekend day.
Yeah.
And I'll use a 3-day average. But I have to use an average because if we're talking every Monday, you might have last Sunday was a Super Bowl. Guess what? You weigh more on Monday.
Oh yeah, I was talking about this with my cousin.
So like that's
he's like, I do my Monday weigh-ins. I was like, good luck.
Yeah, you're just
I was
gonna
like, you're gonna mess with yourself.
You can't do
morning.
that. So you need to work with averages. That's a really important thing. And listen, get on the scale, record it, get right off of it. Pay no attention to it at the end of the day. It's just an easy way to make sure you're moving in the right direction.
100%. So a couple tips that you can give people, like what direction would you point people in? Somebody that's looking to just get started, they're listening to this, they're like, I have no idea what these guys are talking about. Honestly, I can't in good conscience tell you just to go ask your general physician.
Yeah, no, I wouldn't agree with that.
You're going to get pushback. I tell all my patients, I go, look, you need to have all of your doctors aware of everything that you're doing. But when they scare you to death, come back to me with all your questions. It's becoming a more well-known, well-accepted, well-practiced thing in the general traditional field of medicine. But how would people get started? What's step one?
Step one is you can't out-train a bad diet. So we have to get your nutrition involved and make sure that you don't have to follow a diet. Just make sure you're making healthier choices, you know, not eating out all the time, being conscious of what you're putting into your body. And then from there, I would look into, you know, optimizing some of your labs with supplements. And then we can probably talk about hormones. I mean, you get in touch with either one of us and we can run you a full like 50, 60 marker lab panel. And we could just start with supplements first, right? You're deficient in XYZ. We can use supplements to help with that. I formulate supplements for 2 really big companies. I've been in the supplement industry for a long time, and that's something we do a lot. We start there, and then from there, we'll shift into hormones. If you're severely deficient in a hormone, you might start a hormone right away too. But you can't out-train a bad diet, so stop thinking you can. Like, don't think if I go do 2 hours of cardio, it works off the pizza you had at the Super Bowl. And then I would probably start with some detailed labs because your general practitioner is not going to be able to get you the labs you need.
And that's what's
important.
important.
And that's not a fault to them, though.
No.
Because insurance companies usually give them a lot of pushback on labs they order. You know, they could get pushback saying, like, you're not an endocrine. Why are you testing free testosterone on this guy? You know, why are you testing cortisol?
Just dip into your deductible.
Yeah.
Average patient's got a $10,000 deductible.
So then, you know, you come to one of us, we can do that for you, and then we can start talking about your labs from there. And then we optimize you from that point.
Yeah. So, that's a big thing. I always have people say, oh, well, I already got my hormones tested, and it's like a total testosterone. That's it.
Yeah.
That's like their panel. So our panels are a lot different. Like my panel is $250. Through an insurance company, it's like $2,400. But we have cash pricing. So step one, I would say, also, I agree with you. Definitely get your labs tested and then start to focus on optimization and whatnot. I have so many patients that just think if they just take testosterone, things are going to change. You will notice some differences, but you're not going to hit a home run like you're hoping.
Some of you might not even need testosterone.
Right. Whatever it might be
Yeah.
That they take. So you have to work with it. The clip I posted from the last podcast applies to this more than anything. Got to meet us halfway. Right. So we'll kind of like prime you from the inside out. We'll make sure that metabolically, chemically, physiologically, you're where you need to be. But if you're not taking those tools and going out and putting in the work, you're not going to see the results. Okay. How can people find you?
Just on Instagram at Dom Kuza. It's pretty easy.
All right, guys. So I'm excited to start working with Dom on some things for our patients here at Icon. But Dom's got patients all over the country. So I appreciate it, man.
Thank you, man.
We'll do this again.
Appreciate it.
All right, brother.